Sorry, I'm at work and in between craziness, I am trying to submit this assessment. So let's go for it. So my name is Jennifer Holmes. I've been a registered nurse for 5 years now. I have experience in inpatient psych, pediatric diabetes care, trauma, and now critical care. And I'm here today to talk about care coordination and how as nurses, we play a vital role in this process for our patients. So as an overview, outlining effective strategies for collaborating with patients and their families to achieve desired health outcomes. Benefits of involving our patients and our families in care: we have fewer adverse events. Patients tend to have better self-management of their conditions and medications after they're discharged. They have a shorter length of stay in the hospital. And we tend to send patients for less diagnostic tests and unnecessary procedures. Ways we can try to get our patients and their families involved in care to achieve these desired outcomes. The first thing we need to do is make sure the goals of our patients and our healthcare staff align and agree. The patients and their families are just as much of a part of the healthcare team as we are. And I feel that sometimes we get caught up in who's wearing scrubs and who's wearing white coats and who's consulted for this and who's on call for that. No, the patient is the most important person involved in the healthcare team. They have to be considered part of this team and updated about their health and their plan of care in an accurate and timely manner. That is our job. As a psych nurse, I can absolutely attest to the fact that patients become much less agitated if they are updated in a timely fashion and they don't feel forgotten about. Patients and their families should feel safe physically, mentally, and emotionally to share their concerns with us about their plans and about their goals of care. They should feel safe in being honest about their symptoms and their treatment compliance. If a patient comes in DKA and they're not, being truthful about their insulin compliance, that's going to delay their care and they may not get the best outcome. So we need to make sure our patients feel safe in being honest about their compliance and their care. And patients should be encouraged to share their experiences about what they're going through with the hospital and the care they receive to further improve the quality of the care that we give. We should encourage that. We shouldn't just dread these surveys that go out once they're discharged. I routinely ask my patients, how are we doing? When I come in at night, how was your day? How was day shift? What can I get for you? Is there anything I can do better for you? If you have, any kind of complaints or if there's something we're doing good, tell us both. We want to be better. We want to know where we can improve and what we're doing right. Identifying the aspects of change management that directly affect elements of the patient experience essential to the provision of high quality patient-centered care. Patient experience and patient satisfaction, despite being used interchangeably, are not the same thing. So, patient experience is the interactions that the patients have with us and the healthcare system. Their experience, so those interactions, affect the overall satisfaction. So those factors can play an active role in this experience is being treated with dignity and respect, effective and timely communication, like I was just saying, and emotional support. And the satisfaction is the opinion of the care that they receive in relation to their expectations. So if we're not updating them in a timely manner, if they're hitting their call bell and they're waiting 2 hours for pain medication, we are probably not meeting the expectation that they have set. And that is what satisfaction is. It's their expectation versus the care that we give. Is that meeting? If not, then no, they are not going to be satisfied with the care that they're receiving. Explain the rationale for coordinated care plans based on ethical decision making. So there are 4 main components of ethics: autonomy, beneficence, justice, and non-malfeasance. Autonomy: patients who are of sound mind have the right to make their own decisions regarding their health care, even if those wishes go against the recommendations of their providers. And their care plans should be created with the patient's individual goals in mind. And the clinical staff needs to find out early, ideally upon admission at the beginning of treatment, what the patient and family goals are, and try to align those goals to meet with, their care plan. It needs to be a team effort, and the team needs to continue to keep those patients' desires and their right to make their own decisions in mind, and that they have the right to make changes and change their mind throughout the course of treatment. Beneficence, the obligation to act in the best interest of a patient. Even if the clinician often think they are acting in the patient's best interest, sometimes this tends to be where, if there's going to be a clash, this is where it is. For example, let's say a patient is admitted with stage 4 pancreatic cancer. He's admitted to the hospital with a pneumonia. It's becoming apparent his infection spread and he's septic. He's beginning to require more oxygen. His white count is continuing to rise despite multiple antibiotic drips. Prior to this admission, the patient was undergoing chemo multiple times a week. He started TPN, and the admitting hospitalist wants to add another antibiotic. The oncologist wants to switch up his chemo regimen after this admission. However, the patient says, "I'm done. This is bullshit. I'm done." And he says he does not want to do chemo any longer. He's ready to spend time and say goodbye to his wife of 45 years, his grown kids, and his grandkids. He says, I've lived a good life. Let me enjoy the time I have left. The oncologist doesn't agree. The oncologist believes he's acting in the best interest of his patient by suggesting, a new chemotherapy or a new, experimental drug. But the patient's goals have changed during the course of his illness. So now the patient's goals have become more qualitative than quantitative in measure, and he'd prefer to focus on comfort from his symptoms and quality time with his loved ones instead of aiming for curative treatments. Justice, the obligation to treat patients fairly and equally, and the patient will not be discriminated against or treated unfairly, regardless of their race, religious, sexual orientation, gender, criminal history, political views, mental health history, diagnoses, or current prognosis. And non-malfeasance, the healthcare team will do no intentional harm to their patients, which should go without saying. Identify the potential impact of specific healthcare policy provisions on outcomes and patient experiences. Specific healthcare policies that can affect patient care and potential outcomes include individual state nurse practice acts, facility or insurance referral policies, and facility culture and loyalty. So in utilizing the previous example, let's say the patient with pancreatic cancer would like to focus on his comfort measures versus curative treatment. All right, the oncologist doesn't agree with the perspective of the patient. The RN respects the wishes of the patient. However, because of her legal scope of practice under the State Nurse Practice Acts, she cannot place an order for hospice care or prescribe him increased pain medication to relieve his symptoms. She continues to try to advocate for her patient and speaks to her nurse manager and social worker about the situation. However, the next roadblock, even if the physician agrees to hospice care, the patient is on Medicaid, which requires a referral for specialty care from a physician. But because this is a small community hospital, a referral to hospice would be to an outside agency. So the bedside nurse and the nurse manager continue to advocate for the patient. However, now the case manager / social worker is hesitant to approach the physician about the referral to an agency outside of the health system because of her loyalty to the system. All right, moving onwards. Sorry, it is 2 a.m. and I'm just trucking along here. Raise awareness of the nurse's vital role in the coordination and continuum of care. Okay, so the nurse possesses keen assessment skills to evaluate the needs of the whole patient, physically, mentally, and emotionally. The nurse's ability to build trustworthy relationships with the patients and their loved ones is invaluable when developing patient care goals and in treatment compliance. Many nurses are also familiar with the communities in which they serve. Many nurses call those communities home. I, for one, work literally half a mile from where I live. So I'm relatively familiar with the area and the resources in the hospital and what we can do, what we can't, and familiar systems surrounding, the bigger systems surrounding us. The nurse spends the most time at the bedside with the patient and their family compared to most of the providers and clinicians, and can fiercely and accurately advocate for the goals of the patients and their loved ones. The ANA, the American Nurses Association's view, is that patients are whole beings with unique needs, unique perspectives, and lifestyles. Because the nurse spends the most time at the bedside, and you combine that with his or her unique clinical set and her assessment strategies and their compassion, it makes the nurse an essential part of this care coordination process. And I think that is why we are starting to see bedside nurses taking on more and more of a role in care coordination. So to conclude, the most important message I think from this entire presentation, this entire project, is that the patient is the most important member of the healthcare team. Period. Full stop. The plan of care needs to go around the patient's wishes, whether it's qualitative, curative, etc. And we need to combine our clinical skills, and we need to stop and remember that and combine our clinical skills with the reason why we're here. We're here to advocate for our patients. And the more we advocate for our patients and we keep their goals in mind, the more likely we are to have better outcomes. The more likely our patients are to be satisfied with their care. The more likely our patients are going to comply with their treatment regimen. So I hope this was helpful, despite it being 2:15 in the morning. But thank you. Have a wonderful morning, night, wherever you are, whatever time this is.